Our dream was to have a building that was filled with members of the community all the time. Our students, our faculty, our staff, and all of the residents that surround the college.
We've had so many different voices lend their expertise and input to the building. All levels of the campus, faculty, staff, and students, we asked them what could go in this building, and they gave us a whole bunch of input. And we narrowed it down to kind of three concepts: care, comprehend, and connect. And that's what we based the rest of the project on, those three elements.
For a long time, those of us in health professions and nursing and pharmacy have always talked about bringing services to the community. And so these conversations have gone on for a really long time, but it was really hard to feel like we could get it off the ground.
So our mission really is founded in the work of St. Marguerite DYouville. Something that strikes me about her and the Grey Nuns was that they were absolutely fearless. And even though there was times that they didn't know who they were going to treat, what the risk was to them in communities with contagious disease, that is very much the vision of this college then and now, is that we are fearless and we step into things that no one has ever done before.
I think the opportunity itself was attractive because of the challenge, maybe even a little bit disruptive, but in a good way, because it's changing a model that needs to change.
This idea and our mission became a moonshot. You know that you're on a moonshot trajectory when people start joining you and supporting that goal, that project, that audacious idea that you have that doesn't seem possible. That's what happened here at DYouville on our mission to create the Health Professions Hub.
When we started talking about this opportunity, we looked at it as so much more than just being able to provide health care. We recognize that this is an area that has been underserved. We recognize the fact that there are many immigrant families here. We wanted to be able to help create that vision that Dr. Clemo had, to be able to bring in the community into a space and not only provide them with health care, but help them raise themselves up so that they could have a better life.
My first job that I got right out of school was working with the youth in a downtown area in Syracuse. A child that I was working with who was very playful, very joyful child, but had very serious family situations and not having good quality care at home. As it turned out, he had stage 4 leukemia. He passed after less than 2 months. And that was probably one of the most devastating things as a young employee that I had ever faced. So I'll never forget Quentin's face. But when I look around this community and see the children that are in need, the elderly that need care, I see his face in so many of them. That is what drives me to be passionate about this particular project.
When I was a child, my mom was in an accident during the Civil War back in El Salvador. She suffered from a gunshot wound. Knowing that I could lose my mom was just terrifying. But thankfully, thanks to the doctor that, oversaw the care of my mom, and seeing his compassion, his empathy, human care for another person that he did not even know, really struck me. And I realized at that moment that I wanted to be him. I need to give another child a chance to inspire them to become what they want to do, whether it's in healthcare or anything else. And even though it was a struggle, my focus was always, giving back to the community, giving back to the underserved, because I come from that background as well.
When I think about what I do every day, I don't think it's about a job. For me, it's become a calling. When you can find that in your day-to-day life, it changes everything. The experience that's going to be offered on this campus, from the foundational work and then the experiences that students will have by connecting with the community, I think when they're done, they're going to want more than a job. They're going to want to have that feeling that you get when you have that opportunity to interact with people at that level.
Many years ago, the faculty and staff at the college planted this seed, which became our moonshot, to build a health clinic that would serve the West Side. And from that seed, the community added some nourishment, and we started to design a community center that would truly serve everyone in the most inclusive way that we possibly could. And now we are about to open up this community center that truly will change the future of healthcare education. It will change the lives of people that are served here for healthcare, and it will become a model that can be replicated across the entire country with people that have the passion and commitment to really want to help each other and their communities.